Galimera, Galimera, Galimera. Good morning, good morning, good morning. And as you can hear, the cock crows are crowing. I'm on my tablet, sorry, I'm on my phone today simply because my tablet at the moment seems to be playing up a lot. I think it is time for a new tablet. But anyway, I'm outside the house just to let you see what the weather is like. As you can see, we've got a lot of cloud at the moment. Thank you to Amanda for a concise weather forecast. She says, good morning, Ginge. Today it's going to be sunny with thunderstorms. Temperatures, believe it or not, is going to be 18, but it's going to feel like 13. And also we've got a bit of a wind at the moment as well. But if you look here, we've got what looks like blue skies just trying to creep on through. But when you look over there, yeah, it is looking very, very grim indeed. So again, yesterday we had again a mix of sun and rain. Jane got the washing out, and then all of a sudden it chucked it down a little bit later, took all the washing in, and then the sun came out as it does, and then after that it rained again. So she didn't put the rain back out. So anyway, going to do the broadcast again inside the house because it's a bit windy out here at the moment, and I'm not sure if you're picking up the sound of that on the sound. But anyway, I'm on my phone. Big shout out to Trees Around Huggett, also Lynn Sybil, also as well the lovely I think it was Linda Rogers. Did I see Linda Rogers there on the list of people here? Yeah, Hillary Rogers, sorry. There you go. Nice to see you tuning in, Hillary. It's been a while since we've spoken. But anyway, let's have a look at what's been going on within the last 24 hours here in Greece. Can I just first of all say thank you for all the comments yesterday. And as I said before, it's great to be able to agree but to disagree, and there was certainly a mixture of comments. I'd like to make it perfectly clear, I'm not on a soapbox. I am not encouraging people not to get vaccinated. Let's make that 100% clear. All I'm saying is this, is getting people to read and also to understand what is going on. If you want to have the vaccine, you go ahead and have the vaccine, but please start thinking about what's going on. Also, in some ways, look a bit at the bigger picture of what's going on. There's things happening in the world at the moment, which again, smacks more of a dictatorship than of a democracy. So at the moment, I'm not going to say any more on this at the moment. If you want to put any comments, do so down at the bottom. But we've got a lot of news at the moment of things that's been happening in the last 24 hours here in Greece and also in Zakynthos as well. So first of all, then let's look at the COVID infections for the last 24 hours. COVID infections are up, but they're up ever so slightly at the moment. New infections, 6,260. Yesterday we had 6,196, and the day before that we had 7,486. Now we know that there's been one case of the Omicron virus that's been detected, and that was detected in Crete, and I'll go into more detail in that when I get to the main part of the news. However, at the moment, it's not clear of that number of 6,260. One of them is with the new Omicron, and that was in Crete. So again, it looks like that particular strain of the virus has now arrived here in Greece. That brings the total up to the moment to 951,351 since the pandemic first started. There were 13 new cases identified after checks into the country, which was up on the day before where there had only been 3. Now, when it comes to infection rates around the Ionian Islands, which are the islands that we look at, or I look at the moment, because they're basically our neighbours. Cases in Lefkada, that has gone up. You might remember yesterday I said there had been no cases of the virus in Lefkada. Well, today I can report there were 6 new cases reported yesterday. Lefkada is in the green on the Greek traffic light system. Cases in Corfu, they have gone up. Yesterday I reported 88 cases. Today I can report 101 cases, and they are still in dark red. As it comes for Kefalonia, again, they've had an increase as well. Yesterday, I reported 10 new cases in Kefalonia. Today, 18 new cases have been detected within the last 24 hours, and Kefalonia are in alert state yellow on the Greek traffic light system. As for Zakynthos, believe it or not, we've had a slight drop in infections, believe it or not, where everybody else in the Ionian seems to be going up, we're going down. Yesterday I reported 13 new infections here on Zakynthos, and today I can report there's been 12 new infections within the last 24 hours, and we are still in the amber state on the Greek traffic light system. Also, as again, when it comes to deaths, there has been 89 new deaths across the country. That is up on yesterday, where we had 75 deaths. And can I say today that we've also had a death from coronavirus here in Zakynthos as well. And I'll come on to that in more detail in the news section. That means the death toll at the moment now stands at 18,325. 95% of them had underlying diseases or were over the ages of 70 years. And again, our condolences to those people affected. Also as well, it's not clear whether any of those deaths have been linked to the Omicron mutation. At the moment, we haven't had any deaths from that. We've had one infection from it, from the looks of it, from the media this morning. Also as well, critical cases in ICUs, they have now crept up a bit. 664 is what I reported yesterday. Today I can report that there are 704 critical cases in hospitals around Greece. Critical cases in hospitals, 704, 431 of those are male, 273 are female. The average age of those people, 64 years of age, 81% of them have underlying health issues or are over the age of 70. Now, regarding the critical patients, 558 of them, which is 79%, are unvaccinated or partially vaccinated, and 146% of them, which is 20%, are fully vaccinated. In fact, a little point came up this morning, Jane and I were discussing the ICU numbers, is with the vaccinated or partially vaccinated, we're not sure whether those people who had the Johnson & Johnson shot, which was only a single shot at the time, whether they are included in the partially vaccinated number as opposed to the fully vaccinated. It was reported later on, before things became as they are now, that the people who had the Johnson & Johnson were being advised to have a second shot. And then at one point, I think they started doing 2 shots of the Johnson & Johnson. A lot of people chose the Johnson & Johnson because it was just a single shot. So again, it's not been clear if people with the Johnson & Johnson are classed as partially vaccinated at the time, because it was just a one shot, and until they had the 2 shots of the Johnson & Johnson, they were then classed as fully vaccinated. I'm not sure what that would do to the overall look of the figures, but it's just a point of note and just something just to bear in mind, all right? Anyway, let's look at the news today in regards COVID. I'm not bothered looking at the UK news this morning whatsoever, just on the Greek side of things, because there is so much happening at the moment. Anyway, first of all, as I said, we had a death in Zakynthos in the ICU. A 61-year-old man passed away yesterday at just after 2 p.m. On Thursday. He was 61 years of age. Now, he'd fallen ill with coronavirus, and according to the information that's been released at the moment, he was unvaccinated, and he had been in the corona clinic and then went from the corona clinic into the ICU, where he actually passed away. So once again, can I just say, send our sincere condolences to that man's family for their loss at this time. And again, that brings the death toll for December up to 1 person has now died here on the island from coronavirus. And in November, we had 2 people. All in all, we've had approximately 15 deaths from coronavirus since it first started last year. And once again, our sincerest condolences to those people that are affected by that. Anyway, as I said in the infection rates, Greece has identified its first case of COVID-19 of the Omicron variant. The health minister announced yesterday here. The infection was confirmed in a Greek man who lives in Johannesburg, and he had flown from South Africa to Crete for a holiday. Thelegos Zoulas, the head of the National Organization for Public Health, said at a joint press conference with Plevris to specify the measures of the new law mandating vaccinations for persons over the age of 60. Now, the man who is fully vaccinated, so he brought the virus even though he was vaccinated. He arrived in Crete on November the 26th. He took a rapid antigen test at the airport, which turned up negative. A second test the next day after he developed mild symptoms of COVID-19. Again, he received a negative result until a third on November the 29th confirmed the infections. The health authorities confirmed on Thursday morning it was the Omicron variant. Can I just say, in my own experience of what happened to me when I got COVID, I believe that I had COVID earlier than when the test actually confirmed it. And to be honest, in my feeling at the time, I was relieved that I was able to rest and be able to stop working once I'd been confirmed. But I was positive that I may have contracted it before my tests were confirming that I had it. And I'm not sure how many other people might have been in the same situation. I was a lucky person. I got over it. I wasn't vaccinated, obviously, and I managed to fight it. Other people have not been able to fight it. So it'll be interesting to see what happens with this gentleman in Crete, as to see how he fares and see what happens now that it's confirmed that this Omicron variant is here now in Greece. Anyway, it also said that the minister said, he stated that the man remains in quarantine at the moment, and he will remain there until he will remain there in quarantine. And his contacts have also been tested as well, people that he's been with, and they've also tested negative. So again, we'll keep an eye on that, because at the moment we just have one case now officially identified here in Greece. Now, yesterday we had a few people to visit who were unvaccinated, and it was interesting listening to them talking about the situation they find themselves in now, especially now that the new measures for the unvaccinated over the age of 60 are now looking at fines starting from the 16th of January. Well, yesterday more clarity came through, reference how this is going to work. And the fine for the first month of the measure for the compulsory vaccination for those 60 years and over will be only €50, according to information from .gov. Anyway, vaccination is required for those born up to and including December the 31st, 1961. Those who do not make the first dose by January the 16th, 2022, as announced by the Prime Minister, will be asked to pay a fine of €50. And from there on, for each following month, the fine will then amount to €100. So for the first month, because it's part way through the month, basically the 16th, you're going to be able to only pay a €50 fine. So you're still having to pay a fine, even if you go and get the vaccine, but it's only €50. But then after the 16th, if you haven't booked an appointment and you haven't got jabbed by then, you then start to pay $100. Anyway, from there on for each following month, obviously the fine will then amount to €100. Now, according to the information, in the next period after January the 22nd, if the first dose is made before the 15th of the month, the vaccinated person will pay a fine of €50 for the current month and will not be fined for the next month. So even if you decide that you're going to take the vaccine in the following month, and if you do that before the 15th of that month, you're still going to incur a €50 fine when you take the vaccine. But the following month, then obviously you don't get fined again. Okay, however, if the first dose is made after the 16th of the month, then the entire fine of €100 will be imposed and you will be released the following month. So, for example, if someone gets the vaccine on March the 13th, they will pay a fine of €50, and in April they will be exempt from sanctions. On the contrary, if the vaccine is given on March the 18th, he will pay a fine of €100. It is worth noting that if someone does not proceed to the second dose of the vaccine on the scheduled date, when the next day he will be automatically fined €100 and will now follow procedure mentioned above again. So again, it's a bit complicated. Basically what they're saying is that you're going to get a discount of €50 if you go and book it early and get it done before the 15th. And then after that, if you still take the vaccine but haven't had it or have it, you're still going to get a €100 fine, but the next month you won't pay anything. But again, we're going to see how this works in reality. But the good news is, finally, it's worth noting that the obligation to vaccinate over 60s excludes all those who have been ill for the last 6 months. So that puts me in that bracket, as well as those who have a health problem and are exempted based on a special list from the vaccination committee. Anyway, the measures of that specific list are or were expected to be released by the health minister in a press conference on Wednesday. As far as I'm aware, there's been no mention of what the special list of exemptions are in the way of illness. We do know people here who have been told quite categorically if they had the vaccine with the illnesses that they had, they probably wouldn't still be here. Also, as well, we've heard from people who cannot get the vaccine at the moment because of AMCA number issues, etc., where they want it, but they've been sent between AMCA and KEP and sort of going in a circle trying to get the vaccine. But because of the bureaucracy at the moment, they are just not able to get it. So again, I'll keep my ears to the ground. Thank you to those people who've been getting in touch, especially those unvaccinated people who still don't want to be vaccinated, who are waiting to see how things proceed. Thank you for your input into what's going on. A lot of private messages have been going on. I'm not going to say any names or anything else like that, because again, at the end of the day, it's medical in confidence, and I don't want people to start saying you're now revealing medical in confidence. It is a private matter in a lot of respects as to your medical history. So therefore, I do think that the vaccinations should still be in the same category as well. But thank you to those unvaccinated people who are coming forward and letting their voices be heard, basically. Also, as well, since the ruling in Greece that vaccinations for the over 60s are mandatory, there's been a rush to confirm appointments, with 17,500 applying just yesterday. Although the Greek government says it has no plans at present to extend the ruling to other age groups, there are calls across Europe for mandatory vaccinations at the moment to be adopted by member states. Professor of Health Policy at the London School of Economics, Ilias Mosalis, has stated compulsory vaccination cannot be left only to those over 60 years old, which again is a good point to raise. If it's going to be for the over 60s, then it should be for everybody. But that's another fight, and we'll see how the over 60s pans out first. Anyway, Germany again is on the move again. Germany is to ban unvaccinated citizens from entertainment venues and other retail outlets, except for essential services and shops, the same as what they're doing here in Greece. The government there is also to vote on making vaccinations mandatory, which, if passed, could be implemented by February next year. Anyway, also as well, another little message, this time from South Africa. Infections have almost doubled in South Africa in the last 24 hours, driven by the new strain of the virus dubbed Omicron. The latest daily figures in the country registered 8,561 cases, whereas the previous 24 hours, the figure was 4,373. Officials have confirmed that the Omicron has now become the dominant virus mutation in the country. So again, the number for Omicron in South Africa is going up. Also as well, a new monoclonal antibody treatment called Storonab, I think that's how you pronounce that, or Storimab, has been approved by the UK's medicines agencies for patients who are infected with COVID-19. Clinical trials for the new treatment administered by drip into the vein has shown that a single dose can reduce the risk of hospitalisation and death by 79% in high-risk adults. Results have also confirmed that the new drug should be effective against the new virus strain such as Omicron. So the pharmaceutical companies have got something there standing by for the Omicron again. Now, interestingly, with the Omicron variant, it is now obviously affecting the tourism market at the moment, or shall we say the recovery of the tourism market. An article appeared this morning in the Greek press which said that the resurgence of COVID-19 cases in Europe and the new Omicron variant pose risks to the ongoing recovery of the tourism sector, especially in countries with lower vaccination rates like Greece and Cyprus. Anyway, the DBRS Morning Star warned this in a report published yesterday. The Canadian-based ratings agency noted that travel and tourism in southern Europe showed encouraging signs of recovery in summer 2021. Despite the slow start to the summer holiday season, the vaccination rollout, the harmonisation of travel rules in Europe and the relatively good epidemiology situation domestically and in the main tourism sources markets led to a stronger season and helped the sector recover from the 2020 lows. Now, foreign tourism recovered most rapidly in Greece and Cyprus this year, especially during the late summer when compared to Spain, Portugal and Malta. The report pointed out earlier data point to a strong performance also in October. And we can bear that out here in Zakynthos. We had a very good towards the end of the season, especially from September, October, and also August for a lot of businesses was a very, very good month. I was speaking to a hotelier just the other day, and they said that August basically had saved them this year from basically going under because they had such a good August. But anyway, in the in the case of Greece, arrivals from Germany, one of the main source markets, reached 95% levels of 2019 levels from July to September, while arrivals from France marginally surpassed the 2019 arrivals. Cyprus tourism market has benefited significantly this year by a return of the Russian market, which was the second largest market in 2019. Now, it's interesting that they said that. Generally, for Zakynthos, the German market has never been a major player in the way that the British market has been, and now the Polish market is becoming. Although for next year we are getting more flights from Germany than what we've had in previous years, so we're going to see if the Greek demographic rubs off on the Zakynthian demographic for tourism, because the Germans were probably about fifth in the list, with the Austrians probably about fourth above them. I know for the French market, again, I would say they're probably about sixth or seventh in the list of where they stand in our demographic for this island. So they are not two markets traditionally that Zakynthos has relied upon in the way now that the British market was relied on. And I think everybody will agree that for the amount of time that we were waiting for the arrival of the British, the Dutch market kind of came through very strong. The Polish market came through very strong for the hotels, not so much for the bars and restaurants, although we were still seeing more Polish people coming out of the hotels from the all-inclusives. But again, it was the British market that was the market that nearly everybody you spoke to here involved with tourism wanted the British market back. So again, we're going to see how the British market is going to fare for next year, especially now with this Omicron variant that is now starting the jungle drums banging already. Anyway, going back to the article, they said, however, in the recent surge in COVID-19 cases around Europe and the emergence of the Omicron poses challenges and brings uncertainties for tourism in the up and coming holiday period. The DBRS Morningstar expects the tourism sector to continue on a recovery path in 2022, with the epidemiology situation not only in Europe but also globally playing an important role. The emergence of the Omicron variant has raised concerns and shows clearly that the virus will continue to pose risks to international tourism unless a high rate of effective vaccination globally is reached, said Spiridula Tesma, the Assistant Vice President at the DBRS Morningstar. Now, perceptions of the threat of a wider restrictions on travel between the EU and non-EU markets could stall the recovery for the remainder of the year, but this is mitigated by the fact that the majority of tourism flows are intra-European. Anyway, with the summer season behind us, a better than expected recovery in tourism in Greece and Cyprus should help them recover part of the lost ground, said the DBRS Morningstar Vice President. So there you go. We shall wait and see. That's all we can do. But from the information that I've been hearing at the moment, bookings are up for next year. Everything was looking great. However, with everything on a turn this week, it'll be interesting to see if we do see a decline. There was a report just last week from one of the major travel agency agents here that he had started to see with his company a decline in bookings, which had been ramping ahead and then suddenly started to decline. And I've got to be honest, this was before the Omicron variant started to raise its head. But again, we'll wait and see. Keep my eye the local press and see what news comes out from there. Also, again, another story. A local story, a quantity of raw hemp was confiscated. A man was arrested on Monday in Zakynthos by police for possession of drugs. In particular, he was found to have a raw hemp weighing 46.1 grams. He was then sent to the prosecutor where he was obviously taken before the judge. So again, another drugs case here in Zakynthos. And finally, an interesting little story. As you're probably aware, Pope Francis at the moment is doing a tour of Cyprus. Anyway, Pope Francis, it said, will take 50 refugees from Cyprus to Italy. The president of Cyprus announced that yesterday. Pope Francis began his 5-day visit to Cyprus and to Greece on Thursday, seeking to draw renewed attention to the plight of migrants on the Europe's borders and to boost the Orthodox Catholic ties. Anyway, the president of Greece said Cypriot people know better than anyone else about the pain of uprooting and refuge from their ancestral homes. He thanked the Pope for his initiative because Cyprus, he stressed, is a recipient of most of the refugees as proportion of its population, with many flowing through the Turkish occupied territories of the north of the island, obviously making their way down into the south. So again, not sure of the date when the Pope arrives here in Greece, but I'll keep my ears to the ground. Right, that's it with the news today. Just to remind you, I'm on the radio over the weekend on Beatz-Radio.co.uk. First of all, tonight I've got my dance anthem show, which goes out at 7 p.m. in the UK, and then which is 9 p.m. Greek time. If you want to come and join me for 2 hours of uplifting music that puts you in a good place, dance tunes, epics as well as some great modern remixes of old classics. Come and join me for 2 hours on Beatz-Radio.co.uk. And also as well, don't forget Sunday, I also have my Northern Soul show. That goes out at 7 p.m. Greek time. 7 p.m. Greek time, which is 5 p.m. UK time. Again, I'll be in the chat rooms for those shows, so come and say hello and also give me any requests or any dedications or that for future shows. I'd love to have your input as well, which I always do. Anyway, just a quick look at those people tuning in. Can I say a quick hello to Susie Angus, who's tuning in at the moment? I know you were at a concert yesterday. I'm not sure, but if it's the Dance Pops concert that you were at. Andy Joyce is involved with that, who used to work here in Zakynthos and used to be working with us on Island Radio. He's the DJ on the stage with the orchestra, so I'm not sure if he was performing tonight, but normally it's Pete Tong who goes out and does bits in that show as well. But I know from the video clip you sent me, it looked absolutely awesome, as they always are. Lynn Salford is tuning in as well. Teresa Ann Huggett. Who else have we got there? I think Shane Bowen up there in Exmoor is tuning in. Christine Wildridge is tuning in as well. Dean Parler, Yvonne Murray. Wendy Norcliffe is watching. Barry Baxter. Hello, Barry. Nice to see you looking in as well. That's been a while. Chick Ballantyne, again, another ex-RAF Reg buddy, tuning in as well. Rocky Regan is also tuning in. Thank you for your information, Rocky, that you passed to me. I still haven't had a chance to have a look at it, but I will do, sir. And I hope I'm not ranting too much for you this morning. It's all a little bit more nicer. All right. Anyway, Donna Fairclough is watching as well. Dennis Patrick Carroll, nice to have you tuning in. I know you're tuning in from Cyprus. I don't know how the Pope's visit is going with you there in Cyprus at the moment, whether you've seen him or not. But anyway, nice to have you tuning in as well. Right, that's it from me. I'll keep my ear to the ground. If I hear of anything, trust me, I will let you know. And again, you stay safe. Have a great afternoon. Have a great day. And I'll keep my ear to the ground. Ta-ra.